So nice and relaxed and loose. Yep, good. There. And I'm also going to adjust the wrist here too, Mike. Feel that clickiness right through there?
Oh, yeah.
Yep. Good. Valve here. Doing okay?
Oh, that's a little tight in there.
Yeah. Hey everybody, this is Dr. Brady from Kalkstein Chiropractic, and I'm joined here by the one, the only Mike.
Hey everyone.
Mike is new to the office here. He's been in one video here before, and today, Mike, we're going over golfer's elbow. So what golfer's elbow typically is injury to the tendons or ligaments towards this medial forearm here. So it's called the medial epicondyle, and what that muscle, or I'm sorry, what this bony attachment here attaches all the way down, a tendon attaches from here all the way down to your wrist, called the wrist flexors. So that overuse injury, golf for instance, is hence how it gets the name. That repetitive use of wrist flexion when you follow through with that golf shot will cause irritation to that medial epicondyle. It necessarily doesn't have to be a golfing incident where you have that tendinosis. Manual labor jobs, jobs that require a lot of lifting, a lot of wrist usage of that wrist flexion, there could be irritation to that muscle of the wrist flexors there. Today we're going to show you how we treat golfer's elbow, and Mike, I'm going to start off with doing some soft tissue therapy to those tendons that are affected here today. Okay? So I'm going to have you go through the motion as I pin those flexors down and stretch it, okay? Gotcha. So start out like this here for me, kind of that 90, yep. All right, so what I want you to do here, starting positions here, and then I want you to uncurl your arm like this all the way down. Yep, and even those fingers, kind of like your Spider-Man there.
Okay.
All right, what's your favorite superhero?
I don't know, probably Superman.
Superman? Okay,
yeah,
that's
just keeping it classic.
Yep. Nothing wrong with that.
Keep going through it.
Just keep going through it, yep. And as Mike's doing this, go ahead and comment down in those videos of what your favorite superhero is. Yep. And what I'm doing here, I'm starting towards those distal attachments of those wrist flexors down here. And then as Mike is going through that process, I'm pinning the muscle down, stretching it all the way towards that medial epicondyle right through there. So if you're dealing with this pain here, it's a good time of the year. Weather's starting to get nicer, cooling off a little bit. Perfect for golf. If you're dealing with this problem here, come on in, stop by, and we'll do the same exact treatment here. Yep. And then just for video purposes, give me one last one there, Mike. I'm going to sink in a little bit deeper. Feel that stretch right through there?
Yeah.
Good. All right. Good. And then what I'm also going to be doing here, and you can relax right through here, Mike. Okay. I'm going to be adjusting his elbow, the radial head right here. Sorry if I'm blocking your angle here, Carly. So nice and relaxed and loose. Yep. Good. There. And I'm also going to adjust the wrist here too, Mike. Feel that clickiness right through there?
Oh, yeah.
Yep. Good. And then I'm also excited because we can show you the Shockwave therapy, the radial pulse that is new to the office here that works perfect for this kind of injury.
We just got it in today.
Yep. Use it so much so far here today, and it's really, really good for these tendon injuries because of the amount of scar tissue and inflammation around that joint. So what the radial pulse does, it breaks up any scar tissue that you might have in that area. Also gets increased blood flow to that area to really accelerate that healing process. So Mike, if you could have a seat right there for me, please. Bring this bad boy right here. Does that mean you're a DC guy rather than a Marvel fan? If you're Superman?
I feel like I've always liked DC shows more, but Marvel movies.
Okay. I think that's a very popular take there.
Yeah. Not too hot of a take on that.
Yeah. So you can relax that shoulder a little bit here. So I'm gonna get it started here.
Gotcha.
All right. It's gonna be nice and loud. Let me know if it's ever too intense though, okay? I can always back it down. So it goes like that right through there. I'm gonna be working those wrist flexors all the way up to that attachment point of that medial condyle here. Doing okay?
Oh, that's a little tight in there.
Yeah. So especially if you have actual golfer's elbow and some tendinosis injury to the tendon there, it is going to be a little bit tender because this radial pulse is penetrating deep into the musculature and all the way to that elbow joint there. So this is the majority there. We're going to be not only addressing the tendon and near that attachment site, but we're also going to go through the whole muscle itself. All the wrist flexors, all the groups around the forearm there that could be contributing to his problem. We need to get you back out on that golf course here, Michael, because we have another golf outing tomorrow here.
Oh, I know.
So the weather holds up here. So less under there, that attachment, right?
Just a little bit.
All right, perfect. And then the last thing I would do, Michael, I would basically go and recheck your range of motion, see how it's feeling from there. And then I'd also give you a stretch. So I really want you to grab your right hand for me with your left hand. Stretch out so your elbow's locked. Yep, and then just bring those fingers back. Good. As far back as you can. There you go. Do you feel that pull on those wrist flexors all the way down to here?
Yeah.
So that's something that I would do at home there. Another one, prayer sign, I'd go down like this and really bring those hands down towards your belly button, and you can feel a stretch on the wrist flexors there. So that'd be the basic like intro, and then as we move out in the process, I'd give you more rehab exercises as we go along.
Awesome.
Okay? Any questions or anything for me?
Nope.
No?
Feeling better already.
All right, that's what I like to hear. All right, guys, thanks for watching.